Hello, my name is Ravi, and I am a pharmacist for Critical Care and Cancer Center. I am undertaking a service improvement project around Tazocin and restricting its use. Um, the aim is to reduce only the inappropriate use of Tazocin. Currently, Tazocin is indicated for few indications as per the local antimicrobial policies as listed below. Just like with any other antibiotic, Tazocin needs to be reviewed in 72 hours. The blood culture results needs to be analyzed, and ideally, the intravenous antimicrobial needs to be changed to an oral preparation. The one thing I would ask your help in this regards is to please consult microbiology and get their approval only if Tazocin is being used beyond the 72 hours. And also, please could you get the microbiologist's name and record it in the patient's notes. The Tazocin resistance is locally increasing, and we are on the verge of losing Tazocin altogether. And the implications would mean some unappealing alternatives, which may include gentamicin. And what that means to us is increased therapeutic drug monitoring and increased number of blood samples that may need to be collected by the medical team. And it may also increase the workload on microbiology. So, what we would ideally like to do is to use tazocin empirically where indicated for only 72 hours. We are also putting into place a new Tazocin inpatient request form, which would capture information about the day of treatment the patient is on, and if the day of treatment is on day 4 or beyond, it would also capture the approving microbiologist's name. So the help we require from medical team is to seek microbiology approval if tazocin is being used beyond the 72 hours, and please also could you get the approving microbiologist's name to record it in the patient notes. We also need a massive help from nurses to transfer such information, including the microbiologist's name, if the patient is on day 4 of trazocin treatment or beyond. And also, please only use tazocin you have in Medivell for emergency purposes, which will still be stocked, but it must only be used out of hours. When pharmacy is open, please use the green tazocin inpatient request form so we can all fight antimicrobial resistance against tazocin together. Pharmacy will also play a major role in collating all such information and ensuring that tazocin use is appropriate for that patient. And in clinical check, there will be the form will be able to give details about the treatment day the patient is on, and also the microbiologist's name if the patient is on day 4 of the treatment or beyond. Um, Accuracy checking technicians will also ensure that the above details are filled appropriately, and as a part of dispensing, our dispensing technicians would be able to also check if the green inpatient form is being used. Currently, this service improvement project is only targeted at Ward 1. Based on the results, hopefully, we would endeavour to roll it out to all the other wards. Thank you very much for your time, and please do contact me on my bleep number as provided below, which is 4322, if you have any further queries or any suggestions. And I would also like to bring your attention to the little cards that will be placed next to the pharmacy workstations to ensure that this is being followed through all the way along. Once again, thank you so much for your time.